I can't believe it. Again, I met a potential client here at the coffee shop, and they ended up going with someone else. Said they wanted to work with someone who looked more established.
Oh no, that's unfortunate, but honestly, why are you still meeting clients at coffee shops? You should check out J. Kenba Executive Suites.
Jay Kenba? Never heard of it.
Really? It's a professional office space right here in Baton Rouge. You can rent an office that's already furnished, plus they include Wi-Fi, secure building access, utilities, on-site parking, and they even handle the regular cleaning. All you have to do is show up and focus on your clients.
Wait, they handle the cleaning too? That sounds way easier than trying to make my home office look professional or hunting for a quiet spot at a coffee shop.
Exactly. And if you don't need a full-time office, they even rent out conference rooms for small meetings and workshops. Perfect for impressing clients without the overhead.
That's exactly what I need. Where do I find out more information?
Just visit jkenba.com and schedule a tour. Trust me, you'll wonder why you didn't do this sooner.
J. Kenba Executive Suites. We provide the professional space. You create the success. Visit jkenba.com today.
Back in the flesh. It is the amazing Byja Radio Show, and the amazing Byja Radio Show means that we are at season four, episode 35. For all those haters out there, keep doing what you do. It motivates us. And when I say us, that must mean we are talking about the illustrious, the amazing, the stupendous Patient Zero, Mr. George Becnel. How you doing today, brother?
Hey, brother, I'm doing well, man. I'm doing better since you introduced me like that, man. Because it was a great introduction. I appreciate that. You made
Well,
me
I,
sound good.
I think you are feeling better because you realize that haters are going to hate, and that just again doesn't stop us from being great. We're going to do what we do.
Yes, sir. That's
Yeah,
it.
yeah. Again, I'm excited because we're at episode 35. But again, as you have said so astutely, that must mean we haven't been canceled yet. So,
Oh, we have not.
so
And
that
man,
that's impressive. I'm just saying, right? To say we
especially in
have,
this political landscape, it seems like everybody's getting canceled. Man,
to
they
say
got Jimmy Kimmel. God, man, you know how long
not
Jimmy Kimmel been on TV?
not Jimmy, not Jimmy, Jimmy.
Jimmy
No.
got soul. Jimmy don't have no soul, not no more. They
Yeah.
got Jimmy, man.
And the reason why, again, we haven't been canceled is beyond me. But the reason why I'm also happy is because we have new bells and whistles, people. If you only listen to us on the audio platforms, well, number one, thank you. Keep doing that. But number two, we are now having some video components. Now, this is our
Yes.
first time using the video component. We're still working out the kinks. So bear with us. But if you are interested in the video component to see my amazing, handsome face along with this other gentleman's amazing, handsome face, you can definitely check us out on YouTube because we are going to try to have more video components to go with this amazing audio component. But all
Mm-hmm.
things considered, with the new bells and whistles, we are going to have some other things up our sleeve. We alluded to it at some of the episodes in season three. So if you haven't done that, go back and check it out. New shows coming, things like that, which we'll talk about and we'll plug a little bit later. But we're going to jump into why the people came to the Byja Radio. Besides seeing Dr. Jasper and Patient Zero, it is to talk about things health related. And health related, the most important thing that I would say that jumped out to me since our last episode in season three, episode 34, was there was a bill that came out. And most people know it to be the One Big Beautiful Bill. The official name that I tend to use is HR 1. Again, pretty simple to remember. But the HR 1, One Big Beautiful Bill Act, which is the official name, came out and it had a lot of stuff in it. And Patient Zero, since I know you love reading all the legislature, all the text, all the stuff, I'm sure you already know what we're talking about. But the part that we're specifically talking about today is the part about direct primary care, which is in the actual bill, and health
Yep.
savings accounts. Because Patient Zero, you already have said on many shows how health savings accounts are awesome. We did a whole
Yeah.
episode on health savings account, if not a whole episode, a pretty lengthy part of one of the episodes. But one of the things that is in the bill is actual language about health savings accounts. So based off of that, Patient Zero, why don't you give the people a little bit of an idea of what the bill is talking about when it comes to health savings account?
So this is actually one of the positive things about this big beautiful bill, because there ain't a whole lot of positivity in this thing. But this one thing is so direct primary care. It no longer is disqualified under HSA contributions. But what does that mean? That you can use your health savings account now towards direct primary care. And some kind of way it's going to benefit the country. I think it's a great decision. If you're an individual, you can use up to $150 a month towards your DPC fees. As a family, you can use up to $300 a month as a family. So that's actually big news. So, and back up, when we were talking about the HSAs originally, normally that's pre-tax, tax-free money that you can put towards anything health wise in a separate account, right? So the fact that now you can take your membership fees, put it in your HSA, and not be taxed on those dollars, it helps you as well,
Yeah.
and also
And
helps Dr. Jasper because
uh, ma-
there's going to be more patients.
and I appreciate any help I can get. The way these bills are lining up, they're never going away. So I appreciate any funds that come through the door and end up hitting that bank account. But I think
Hmm.
one thing that's important that we should reference is that people may say, well, hasn't it always been where HSAs were available? Yes and no. Depending on where
No,
you're located, some people were not able to use HSAs and be quote unquote fully in compliance. Now, some people may do workarounds where they're still using it, even though they may not have the ability to do so because their employer told them not to, whatever. But the point that a lot of people don't know is depending on where you're located across the country, the HSA sometimes saw direct primary care as being a second health plan. So and I'm making it up, let's say in the state of New Mexico, they may have said, well, you have insurance, which is your first health plan. If you go to direct primary care, that's the second health plan. And with the HSA, you can't do both. So because of that, they would automatically not allow you to go to direct primary care and use your HSA to cover the cost of the membership. So this bill is now changing that to allow people across the country, starting in January of 2026, that they can now use their HSA dollars with a lot less headache, up to $150 for an individual, up to $300 for a family, through an HSA to cover their membership. Whereas previously, it was almost like on a case by case basis. And to some
sure,
people, that might have been a little confusing, but that's the part that kind of clarified things. If you're in one of those places, one of those states that doesn't allow you to use an HSA, now you know for sure you can because it's kind of ripping that band aid off and saying, hey, you absolutely can use the HSA. On top of being able to use it, here's the amount you can use it up to. Now, there are a few caveats, and Patient Zero, I want to definitely get your thoughts on this because I think you're going to probably be on the same side of the conversation with this based on what I felt when I saw it. What do you think about the total being $150 per individual versus $300 for a family? I want to know if you think that's good, not good, too high, too low. I want to know your thoughts on that because there's a lot of discussion among DPC doctors, and we can talk kind of about how DPC doctors feel in a moment. But I want to hear your thoughts. Do you think the number is a good number, not a good number, decent for now? What are your thoughts?
so I think the number is better than zero. Let me say it like that,
Okay.
right?
Is it better than
However,
patient
it's
zero?
not enough, or it's nothing coming out the White House that's better than patient zero, baby. I'm gonna just let you know that now.
I'm only
I'm just,
laughing because not
I'm
only
just letting
that,
you know.
what you just said is funny, but the second part is you got so Louisiana there. Like you got so Southern Louisiana, it wasn't even close. You weren't all of the middle of the road radio voice, like super technical Walter Cronkite, whoever you wanted to be, went out the window. Like you ain't nothing
Yeah,
coming out the
man.
White House,
My,
Louisiana, baby. Like I was waiting for you to hit me with that baby no, right? That New Orleans. I was waiting on that to come out. But go
well,
ahead.
it's more of a River Parish accent being I'm from Donaldsonville, and it's not going away anytime soon. But
Never.
sometimes I can channel my inner Bryant Gumbel And shout out to Greg, by the way, and just and speak eloquently. But sometimes, it just that Donaldsonville just come out, bro. But
I know. And I only said that because I've had people tell me when I get excited, the Southern Louisiana creeps out as well. But otherwise, they're like, we didn't know where you were from until you got really excited, and all of a sudden it started
yeah, yeah,
leaking
yeah.
out or whatever. So yeah, that was pretty funny. But go ahead.
But yeah, so I think the number is better than zero. Um, so you might be able to split your payments and put 150 or 300 if you have a family towards your membership fee. But most, if I'm not mistaken, most DPC fees are more than $150 a month for an individual. And most and especially if it's more than 150 for an individual, it's got to be more than 300 for a family. So I think the number is a little low. So I applaud the change as something positive, but it's not enough. So if I'm somebody who I'm a contributor, and let's say, well, I am somebody who uses an HSA. How about that? So what I'm going to do is I'm going to allocate more than the 150, uh, and do a split payment, put my 150 toward my membership fee, and pick up the balance on another payment on another card, and also just use the rest of the funds for medicine, things like that. Because it doesn't say you have a cap of how much you can spend. It's just a cap on how much you can use for your membership fee. Now, if you want to be a little aggressive, Patient Zero doesn't advise this. However, you can put more money in there and pay your whole membership fee. The card will go through, but that doesn't mean you won't be audited. So I just want to put that out there like that, because a lot of depending on your HSA account, who is through, you might be able to go buy groceries with your HSA.
Hmm.
That just because you're not supposed to do it, don't mean it won't go through, but you might be subject to audit. I just want to put that out there.
And I'm going to say the conversation is if you're doing things in an unscrupulous manner, you're going to more than likely have a problem down the road to where that
Yep.
HSA now becomes um, disqualified along with the transactions, of course. And now you owe these people, quote unquote, their money back. So I think that's a huge thing. So I'm glad you pointed out. I also agree that I think it's too low. I think it's too low not only because of the individual versus family part, because you don't really know what a person's spending should be, but I also think that it could be that, as you mentioned, it's a good place to start. It's better than zero. And we're happy about the idea that it's going up. And hopefully it continues to go up to where the cap is a little more reasonable. Because again, depending on where you live, this could be more than enough, but it also could be not enough or not close at all. Imagine if you're living in New York City, that membership cost may be a lot different versus Los
Correct.
Angeles versus Baton Rouge versus Chicago versus Midwest. A lot of the DPC docs who tend to be in the Midwest, their prices may be on the lower end, whereas people who are in major metropolitan cities or capital cities tend to be higher. So I think that's a huge thing. And I'm gonna say one more: a family of fill in the blank may need a higher cap than a family of fill in the blank. So if you're a family of three, $300 may not be bad. But if you're a family of seven, I mean, so I think that's the issue when you just put these arbitrary caps and there's no rhyme or reason to it. So I think that needs to definitely be flushed out. But as you said, it's better than zero. And I think you hit a huge home run when you said people need to be mindful that somebody may tell you, hey, look, the membership you have for your family is $385. You can just go ahead and swipe it all once, even though the cap is 300. But when they go back and pull those transactions and realize that you overpaid, I don't think they're going to just let you slide and be like, oops,
Mm-mm.
my bad. They're going to
They
say,
gonna
we
want
want our
some
money
taxes
back.
on that $85.
They're going to want their money back one way or another. And they're going to
Yeah.
probably get it one way or another. Maybe you cutting them a single check or them starting to garnish those wages, if you will. So I think you got to be real careful with that. But I do think it was helpful to see progress being made and that it's written into legislation. It tells you direct primary care is not going anywhere. And if direct primary care is not going anywhere, why are you, if you're a listener, delaying the inevitable that you need to just come on over? It's better over here. Patient Zero says it. And if Patient Zero says it, it's good as gold because most people who have done direct primary care, to my knowledge, don't leave. And if they don't
Yeah.
leave and the government is starting to write legislation about it, they're starting to put numbers to it, they're putting dollars to it. Like, what are you waiting on? Now, the
So
other part I'm going to say, and I'm going to throw this to you as well. Go ahead. It looks like you got something before I forget.
go ahead.
Oh, well, my question to you was going to be, what are your thoughts when it comes to human resources with this? Because that's the other thing that is potentially missed. Because now that this is written in the way that it is, that it's, hey, you can make an HSA contribution to cover DPC. How do you think HR people should handle this, or how will they handle this? You may say they should do it like this, but what they are going to do is this. Tell me your thoughts when it comes to that.
So, you know, being in corporate America, my entire adult life, just about, um, I don't think HR does a good enough job explaining health savings accounts and the benefits. I think the only kind of information I got from you know an HR perspective is tax free money, essentially. So you might as well use it, and that's not very helpful. So I don't think HR is going to do very much with this information because nobody's talking about DPC. Everybody's only talking about the difference in your plans, and it's still not really that helpful with that, in my opinion. I just happen to be fortunate enough to have people around me, um, like a Dr. Jasper or like my good friend Stan Savage, who works in insurance, where I can get my questions answered. Right.
Mhm.
So I think HR has to do better with it. But I will say, if you've been keeping up with the news, and part of the reason why um, the government decided to do this is because everybody's premium is going up next year.
Mhm.
So your insurance premiums are going to be more. Um, so a decision I made 4 or 5 years ago, when I first looked at this, was I had to do some math, and I had to lower my premium, which mean I had a higher deductible. But because I have a HSA and I can pay for things like my medicines, my labs, things like that, and I pay a membership fee to the clinic, it allowed me to be able to have a higher deductible plan.
Mhm.
So being that your insurance premiums are going to go up, it might be helpful to take a look at direct primary care, especially since you can now pay for your membership in 2026 with tax-free funds.
Mhm.
Because everything in America is going up, man. People can't buy groceries. So you might as well save money where you can and still have access to quality care.
Mhm.
So I wish HR would have these type of conversations, but it's very important. If you know your premiums going up, you might be able to take a higher deductible plan, since now you can use 150 or $300 towards your DPC membership fee.
Absolutely. And I will also give 2 to 3 points that we should, definitely go over. Number one, shout out to Stan. Number two, his name is Stanley Savage. Number three, he is not a superhero. He's not a wrestler, and he's not a male exotic dancer that I'm aware of. No,
he's
I'm joking.
he's not. He
I'm
probably missed an opportunity.
all three professions, all he, it
Man,
would be an
you
amazing
just got.
trifecta, right?
You're
But
right. You just got a built-in name like that, man. It's marketable, man.
I mean,
But yeah,
anything that is an entertainer, that is an amazing
yeah,
name. But definitely shout out to Stan. And another thing that you mentioned that I think is important is that I agree again. And I know sometimes we kind of slightly disagree, but I agree 100% that HR doesn't tend to know a lot about direct primary care. They may know a lot about HSAs, but not how to put them together. So now that this is in law, you would think they may say, well, look, we need to educate ourselves on how to make sure we get the best for our clients, our employees, or whoever you want to call it, that allows us to make sure they're getting the full benefit from a tax standpoint and a health standpoint. And we as a company also may get a benefit from that as well. But I don't think that's going to happen because when I've had a couple conversations with people in the HR side of things, they were like, wait, what? What's DPC? And I'm like, so It's written in the law. It's going into effect in January. Open enrollment is coming. You all are about to basically pick insurance plan for your employees, and all of these things are happening, and you still have no idea what direct primary care is, even though it is literally written into law. That goes to show how much of a gap we have from what's being written and what's being executed. So I think the employer benefit people will have a high hill to climb to get this going and working the way it needs to, which then, of course, now turns into getting the employees to use it. So if the HR people don't know how to explain it or sell it or approach it, it's going to be really tough for the employees to buy in and use it. And then, of course, direct primary care is going to continue to have that struggle of people learning what it is, because the people who are entrusted with getting you to make the best health decisions for your company don't have any idea, and you as a CEO don't have any idea. So it just basically turns into money left on the table in my book. And I think that doesn't make sense. And I think that needs to be addressed, because we need to have people who are sitting in those seats when they're choosing benefits to have more knowledge about this, so it can be helpful for those who can use it, especially those who are going to go to the clinic over and over and over again for multiple comorbidities. And those people are going over and over again, charging a copay every time, having a claim every time, doing another claim for medication. Like, all of that can be so much cheaper, so much more affordable, so much more efficient, but you just have no idea it exists other than what you hear in passing. And it takes somebody like Patient Zero or myself to break it down to you. I mean, we're kind of late in the game by the time you hear about it from us, unless you're, liking, subscribing, or sharing. If you're doing that, then you're in the right space. But if you're not doing that, it can be problematic. So I think we need to do
So
our due diligence at Byja Radio, making sure we keep educating the people, Patient Zero, specifically about things like HSAs, DPC, and amazing potential wrestling names like Stan Savage. I mean, I think it's a really good thing that we continue to do. So outside of that, within the actual HSA focus, what things you think could be helpful when it comes to this bill, when it comes to the HSA, any tweaks that you think might be helpful that, people who are sitting in the audience listening to us or watching us will say, hey, what else can I do that may be helpful to push this forward? Of course, we can have you go to your HR people and, tell them this is something we need to look into. But is there anything else you would say that maybe a suggestion that could be helpful for people, Patient Zero?
well, number one, I was thinking there needs to be a direct primary care directory if there's not one already,
Hmm.
because it's easy for me to be in Baton Rouge, Louisiana, and tell them go check you out, but you got people all over the country, and even though your remote care is actually really really good, I don't know if somebody who lives in Las Vegas is going to want to enroll in the Baji clinic, right?
They could.
So
They could.
they
I mean,
could.
we got good food. Let's start
They
there,
could.
okay?
Well,
Because
I'm just saying you might not want to get on the plane to get to the doctor. I'm just saying
I mean, if LSU is playing, they might. I mean,
they
clearly
they should.
Tiger Stadium is kind
Yeah,
of a place to be if I had to go ahead and explain it to people in Las Vegas. But that's just me.
yeah. I feel you. So I think there needs to be a director, because when you select your plans, in the HR website, there's a directory of doctors that are in network and out of network. So that's something that the people can do, or the people can have, where they can actually see that option broken down for them. Well, do I have a direct primary care doctor in my area? Um, I know it's a little bit of a newer practice, or like a less popular practice, but
Hmm.
it's something that's worth taking a look at, right? So I think there needs to be a directory. Number one, number
Hmm.
two, and I think if that's something that you're familiar with, play your part, man. Have that, have some water cooler conversations, with your coworkers, because we talk about everything else. We talk about how to make our jobs more efficient. We talk about, hey man, what we doing with the family. I had a conversation with my sales engineer. We were talking about like what kind of car he was going to buy for his daughter. Things like that. When we're having these casual conversations, let's talk about direct primary care, um, especially in current events, because we all going to have to go through open enrollment very soon, probably next month, and have to make some new elections. And then when we see the price of these premiums, everybody's going to be talking about it. So if you're familiar with direct primary care, have the conversation. Say, hey, if you have a doctor in the area, hey man, go check out Doctor So and So, or like at least look at it, because I don't want half of my check being taken out for insurance premiums. It's already a hell of a cost, and then if you have a family, that's a lot of money taken out your paycheck.
Mhm.
So there's going to be some conversation about it. Let's just talk about it, and I think that's helpful, because you know people can listen to our radio show all day long. If they know us, we're actual real people to them. Like an Antonio cousin who decided to enroll after listening to this, that makes sense. But somebody else may hear this and kind of be like, oh well. But if Timmy from accounting that you work with is in direct primary care, now you might be more obliged to listen,
Mhm.
because you got a face to put with it. So I'll say the biggest thing people could do is just have open conversations about it. There's a lot of there's gonna be a lot of current events, and man, like you know, I'm always. I know this is a medical show, and it's based in medicine. But if you've been watching the current events, we've talked about the tariffs before. Prices are just now beginning to rise. Like this, like we're not done with rising costs for everything. Why not be the most efficient you can and be the best steward of your money? And I think looking at direct primary care, taking advantage of the HSA, and maybe looking to lower your premiums, like it is good due diligence. And I'm not saying you have to make the switch, but at least consider it, at least look at it, because if you're not looking at all the options, you're doing yourself a disservice.
Yeah. And I'll jump in and say that I agree with the idea that spreading the word is going to be a huge thing that people can do, right? Direct primary care is here. It's not going anywhere. It's been around for 20 plus years easily. A lot of people may have just heard about it yesterday, last year, 2, 3 years ago, but it's obvious that it's pretty big in the sense that it's been written into law in a lot of places. Some places, not so much. Some states are not as favorable when it comes to direct primary care laws. Some states, fortunately, like Louisiana, we actually do have a lot of fair legislation that promotes DPC. So I'm happy about that. But it's still not enough because I still get at least 3 or 4 calls a week. And the first question you think people ask when they call the doctor's office, if
You
they're
take
trying to get an
insurance.
appointment, well, you would think the question is about medicine or the doctor and their education. The first question always is do you take my insurance? And it has absolutely nothing to do with healthcare. It has to do with the illusion of healthcare, because if you have insurance, somehow the care is going to be better, or if you have insurance, the care is going to be more efficient. If you have insurance, the care is going to be more affordable. And it's all backwards. The insurance actually becomes a barrier to care. So the more people know about direct primary care and using insurance only for bigger ticket items, similar to the car insurance industry, we'll end up having a huge, huge benefit, a huge bonus. I think the other part I think people should do, besides, of course, spreading the word, is emphasizing to people who are potentially looking into these policies, looking into these plans, looking into the type of legislation, is adding more than just the membership. I think, and you already know this, and correct me if I'm wrong, and if you're okay with me sharing, feel free to kind of give me a look now that we have a video that if hey, we're not doing something well, we need to do something different. But if we are
Hmm.
doing this in the right way, when you are talking about DPC, other things come up that are important. What are those other things? Medications and labs. Right now, if I understand correctly, the DPC membership within the bill doesn't say anything about meds. It doesn't say anything about labs. Whether you like it or not, that's a part of medicine. A part of healthcare is giving people medicine and lab work. So why not add those two things? Now, you may not want to go and do surgery in the bill. You may not want to go and do anesthesia in the bill. You may not want to go and do procedures, but labs and generic meds should be included within whatever setup you have for this type of policy. And if you are doing that as a consumer, as a as a human resources person, it probably makes your package a lot more attractive for an employee compared to, well, you just need to pay for this membership with your HSA. And they say, well, what's an HSA, what's the direct primary, like I don't get it. But if you say, well, look, if you take this plan, you can pay for your membership and X amount of dollars toward a generic medication, X amount of dollars towards labs every month or every 6 months. That now makes it more deliverable to someone who says, I can probably use pre-tax dollars, get standard primary care, focus on prevention, do things in a way that allows us to save money, save time, be more efficient, because now I'm not arguing with the insurance whether they should cover my medicine. Now I'm not arguing with the insurance if they should cover this lab. I just get it wholesale, I pay for it, and I'm done, and it's with pre-tax dollars. It just makes things better, faster, more efficient, and easier and more transparent, especially if your dollar amount for labs, and let's make it up, it's $50. And you know that the standard labs that you're probably going to get is $45. I mean, at this point, why wouldn't you write that in and say maybe you have 150 for the membership, maybe $50 for the labs, $50 for the medication. So now at this point, you're all in at 350, and that 350 now allows you to stop filing all these healthcare claims to go to the doctor to get generic meds, to get labs. Premiums start to go down. Like, it makes more sense to not use your insurance than it is to do that. And if you can educate people on how it works, with
Sure.
the labs being included, with the meds being included, it's much better in my book.
So, and I want to mention something, because I agree with that wholeheartedly. In 2025, the HSA contribution cap was $4,300 a year for an individual, and for family it was 8,550. Well, 8,550 for family for a year. So I agree with you that education needs to be there, because technically with a health savings account you could buy anything that goes towards your health. Correct me
Hmm.
if I'm wrong. So
Yep.
you could pay for those prescriptions, you could pay for those labs with that. You could actually pay for band-aids, you can pay for vitamins, you can pay for medicine, you can pay for Advil, for Neosporin, or whatever you got going on over there, as long as it's something non-food related
Hmm.
that's going towards your health. Like, you can't go buy groceries with it.
Yep.
But also something else that you need to be aware of: some companies are doing a match on your HSA. Because to Dr. Jasper's point, you know, when you're talking about healthcare, and maybe I'm going a little too far on the deep end, but especially most big employees, or what they called self-funded.
Hmm.
So they're actually paying the claims themselves. So they want to give you as much incentive as they can to pay for your own stuff. So it's even cheaper for them to match your health savings account than for them to pay out claims. So as a as an employee, you need to be taking advantage of this.
Hmm.
So, go to your HR. Now, that's one thing they'll be able to tell you: how much does your company match? Because one of my former companies matched it dollar for dollar. I think up to $300 a month,
Hmm.
something like that.
Yeah.
So now you put in 300, you get another free 300. Now you had $600, and all you contributed was a tax free 300.
Yeah.
You know what I mean? So, like, that, to Dr. Jasper's point, that education needs to be there. But if you're listening to this, feel free to look into what we're saying, and then you go talk to your employers, and then you can make some of these decisions for yourself. Because you know we all do labs, we all go get medicine, and if you're not doing that, you're buying Advil, you're buying Tylenol, you're buying multivitamins, you're buying this, you're buying that. Take advantage of this.
Yeah, might as well, because again, leaving money on the table doesn't make sense. But I think we have done our listeners a service, and potentially people who aren't aware of that change in legislation. We have hopefully educated them and allowed them to learn something new, of something that's recent, that is DPC relevant, but also legislation relevant. So with that being said, I think we are able to successfully go to our first commercial break of season 4, Patient Zero. Would you say that's pretty fair?
I think that's fair.
All right, so we will be right back after this at Byja Radio Show.
Hello there, it's Dr. Jasper from the Byja Radio Show. Are you tired of the broken healthcare system? Frustrated by long wait times to see your physician, rush visits, and the sky high healthcare costs that come with those rush visits? Yeah, I hear about it all the time. So if you're tired of dealing with any of those things, then I highly suggest you check out the book Byja Blueprint, an introductory guide to direct primary care for patients, physicians, and businesses. Written by yours truly, it breaks down all you need to know about direct primary care, a model that makes healthcare simple, affordable, and personal again. The book covers topics like how DPC differs from traditional insurance-based healthcare, what's the difference between direct primary care and concierge medicine, how employers can use DPC to cut healthcare costs, how this model reduces burnout for physicians and improves work-life balance, and so much more. Whether you're a patient, a doctor like myself who was fed up and burnt out, or a business owner tired of rising healthcare costs, this book lays it all out in plain English. So if you're ready for something better, check out Byja Blueprint, available in paperback, audio, and ebook format. Visit bookstoread.com/Byja Blueprint DPC and get your copy today.
All right, we are coming back from the first official commercial break from season 4. Patient Zero, I think we should take a quick moment and just highlight that we are doing big things over here, right? So we obviously have Byja Radio. You are the world famed Patient Zero, because I've had people literally stop me and say, "Tell Patient Zero X, Y, and Z." I've sent you screenshots of people actually telling us Patient Zero is hilarious. Like, so you are a phenomenon, and that all started from Byja Clinic. We have the Byja Blueprint book, which obviously that's a commercial that we've run. We have the Byja Charitable Alliance. We have everything almost Byja Palooza over here, right? So everything is really heavy in Byja. But one thing we need to highlight is that we have a new Byja family member, and that is actually the Byja Broadcasting Enterprise that this show is a part of. And what that means is we now are basically a home for people to have podcasts. Or if they were coming in talking with us, it wouldn't be a podcast, it would be a radio show, right? So with this
Yep.
being a radio show, people who need a home for podcasting and things, we are looking for other shows. But to be official, our first official show under the Byja Broadcasting Enterprise, or BBE, besides Byja
It's
Radio,
about
will be the Premium Perspective. So, anybody have any idea what Premium Perspective is about? You probably wouldn't have an idea other than just saying, well, I can take a guess. So, Patient Zero, you kind of know what it's about. Do you have any idea what you think people would say the Premium Perspective may be about?
when I hear premium, I think people are automatically going to go to like consumable goods. You
Correct.
know, like buying Louis or buying some Gucci or
Expensive
like a
stuff.
Bentley or something.
Yeah.
Yeah, just yeah, high price stuff.
Stuff that you and
That's what I
I
think.
are allergic to because we like keeping money in our pocket. There are other people
Mm-mm.
who may be
Fancies
listening.
I get is polo.
You doing more than me. I'm still in Costco. I'm still in Costco. Those pants are actually pretty comfortable, though. That's all I'm saying.
Man, look, I got on some Kenny Cole pants from Costco right now.
There you go.
Costco,
So
and look, dog, they got Banana Republic T-shirts if they $10 a pop.
that's what I'm saying.
Boy, I love Costco,
That's what I'm saying.
and I will buy Kirkland brand anything. I know we don't have a partnership with them, but maybe we should
Maybe we should.
because because look, I don't buy off-brand much, but I buy Kirkland from golf gloves to Canadian whiskey, to toilet paper, paper towels, dishwasher tabs, you name it. If it got Kirkland on it, I want it.
You got it. There you go. So anybody, if you work in the Costco empire, number one, we are available. No shame here. Number two,
Nope.
we are able to not only promote your stuff, but more importantly, we are able to just use your stuff, because we like free stuff. I don't think anybody's wrong with that, right? But
Mm-mm.
back to the point, I think
Just
you're
pay for my
100%.
membership.
Yeah, there you go. Just give it to us for free. We talk about memberships
Yeah.
anyway, right? Just give it to us for free. We'll save on that. I mean, I would like free gas. That's what I was going for. So perfect segue
What?
because premium could also be gas, right? I think people might think it has to do with potentially things in the auto industry, but in
I'm
a
about to
way,
say, when I hear premium, I don't think of gas. Because I'm putting 87 in that Chevy.
There you go. Right. And you already know the Nissan is what? Nissaning. So I'm definitely not putting
It's
premium, but
87,
there you go. So
like
if
Dwight
it's
Clark.
not consumables, it's not auto industry. The funny thing is it's tied into all of those potentially. So the premium perspective is actually going to be about insurance and how the insurance industry can be something that I believe will be utilized in very unique ways. It's not just about paying for your premiums and that's it. It's about how do you use insurance in business? How do you use insurance to get creative in ways to cover yourself, your family, your valuable goods, your auto stuff, your home, your flood, all that stuff. So we got an insurance expert who's actually going to start a show uh, called The Premium Perspective, and it's going to be under the BBE network. So with that being said, stay tuned, right? We're going to definitely have that coming out in the next week or so. No pressure on the host. He listens to our show, and once you get to meet him, we're not going to say who it is. We're going to let him introduce himself, but no pressure, okay? I'm looking into the camera specifically at you saying no pressure. And after we are done recording this, I'm going to send you potentially this clip saying no pressure just because I want to put pressure on him. But with
Yep.
that being said, the Byja family is growing one way or another. You can either join the train or what is it? So you can hop on board or get run over. Like that's how we are over here. We're doing big things over here. So we are going to go back into our DPC bag and health bag now that we've given a little bit of uh, variety to the listeners of the Byja Radio Show to let them know that we're doing other things and venturing into other industries. And if you are a person who's a podcaster that have an idea and you think you might want to give it a shot under a great network, go ahead and hit us up. But besides that, we're going to talk about something else that's in the news of late, and that is the Make America Healthy Again strategy or the MAHA movement. And the MAHA movement has been Mahaing or Bahaing, however you want to say it, because I will say that it has been very creative at trying to introduce things that could be helpful for a lot of people. But I think that the issue we're running into is that it's not being executed to the finest point. So if you're not familiar with the Maha movement, it is something that, has been out for a little bit of time now. And it's basically the Health and Human Services department's way of trying to give new initiatives to make people healthy within the United States of America. With that, Patient Zero, do you have an idea about how many proposed initiatives are within the MAHA umbrella or under the MAHA umbrella, I should say? Because obviously, we heard the name, we heard the phrasing, we know it's a thing, we know it's supposedly a movement. What are you thinking the number of initiatives they may have under this umbrella? And again, doesn't have to be exact, ballpark. You thinking 10, you thinking 25, you thinking 40? What do we think?
I'm thinking about 150.
Okay.
I think it's a
So,
lot.
yeah, it's definitely a lot. So it's actually about 120, which is pretty funny to me because most people don't know 120 medical diagnoses. Most people damn sure don't know 120 things that can affect them medically. So with that being said, how did they come up with these 120 initiatives? I think what it is they just found things that they think are a problem and started throwing them under the umbrella, which goes into the execution thing, right? Like
Like
you're just
like
doing stuff.
vaccines, like
Well,
vaccines being bad for people.
we already had a topic on that. We're not going to go down that road because we can always circle back to it. But that just goes to show you it's just doing stuff, right? So I'm
Jesus.
going to
Yeah.
name some of the things that are in the Maha movement, right? So some of the things make sense, right? Trying to tackle bad dietary choices, right? I'm being very broad. I'm not going to go into very specific things, right?
Makes
Trying to
sense.
eliminate ultra processed foods, trying to
Makes
help
sense.
children deal with stress and have better sleep habits, trying to remove chemicals from food products. Thoughts on those, Patient Zero? Thoughts on those? Because I think those are pretty good, but I want to hear your thoughts. Do you
I
think
think
those are
I
simple?
think those are all appropriate. No, it's not simple.
Okay.
That is not it's not simple. If you picked up a product in the grocery store as of late and looked at nutrition facts, that's definitely not simple. You know, stressing kids, that's not simple to deal with either. So I don't think any of those are simple. I think maybe coming up with the idea might have been simple, but the execution that has to be very detailed and well executed.
Hmm.
So yeah, that's gonna be very difficult to do, but yeah,
Yeah.
I think it makes sense.
And that's why I said I think they're good, but I think again they're just kind of saying, okay, well, we're going to do a lot of big idea things, and then come down and start just slashing, cutting, gutting stuff that sounds like a better thing, but then you don't have anything to replace it with. So those are things that are really, really surprising. I get the concept, I get the idea. We want to make stuff better, but let's take a bunch of stuff away. And when you say, well, how are you going to fill the void? How are you going to fill the vacuum? Well, we don't know, but just take that away and we'll figure it out later. And it's like, that's probably not a good strategy. It's like saying, well, look, the bridge is not working. We need to stop and take the bridge away. Well, how are we going to get across from here to there? We don't know,
Hmm.
but just stop using the bridge. And I'm like, well, in a way, I get it. But if we got to get to the other side, you can't just take stuff away and hope that people are going to survive. They're going to go off a cliff. And I think that's an issue that we're having. So things like improving food quality make sense. But if you're basically taking away SNAP benefits for people, which is basically food stamps, to somehow also improve food quality because, well, we want to keep the budget down, we want to save money, so we're going to take food stamps away. And then that's somehow going to, like, it's just doing a bunch of stuff.
Well, now we enter in a different conversation.
Hmm.
Like that's not designed to get people healthy. When you rolling back, when you're rolling back um, SNAP benefits, that is an attack on a certain demographic of people. So that is not any. They might say it's an attempt to make people healthy, but that's not helping people get healthy. Now, let's say that you decide to say, well, let's not make Skittles a part of something that's SNAP eligible.
Hmm. Yeah.
Maybe.
Yeah.
Or we pull Skittles off the shelves because Skittles is terrible for you.
Yeah.
But, and look, Skittles, please don't sue us. I love Skittles. They're delicious. It's just, it's just not healthy, right? But, like efforts like that is designed to get people healthy. But pulling SNAP benefits, that no way, shape, or form gets anybody healthy.
Yeah. And I think that's kind of an example of somehow on paper, somewhere in theory, thought this is a good strategy. And
Mm-mm.
that's getting lumped into different things that may or may not. Because, well, if you're using it to buy bad foods, then we just need to take the SNAP benefits away. That doesn't make sense, right? Like it, we
Now,
may.
now you can limit what you can buy on those SNAP benefits. You know, if you tell me you have to buy water or a certain type of juices on SNAP benefits versus buying Coca-Cola, then I hear you.
Hmm.
But removing the benefit altogether, that's not helping people get healthy. That's actually hurting people.
Yeah.
And I think that's done on purpose.
Yeah. And I think, like you said, talking about improving school lunches, good in theory, but the strategy of how to do it and how you're going to measure it and how you're going to know that it's working, they don't have that. Like that's the part that I'm really more concerned about.
I
I'm
see
never
what you're
going to
saying.
sit here and argue that some of the strategies that you're implementing are going to take some time, but you're on such a rage of taking stuff away and for lack of a better term, changing things that you're burning down the building that you're trying to rebuild at the same time that you're trying to rebuild it. It doesn't make
Hmm.
sense. And it's just a bunch of things that they don't really know what they're doing, but they're doing it anyway. For things like ultra processed foods, there's no real federal definition on what's considered ultra processed foods. So if you're taking it away, now it's a subjective thing that you may think an ultra processed food is different than what I think it is. But you took it away because you thought it was, and I think it's actually pretty healthy. And it's probably healthier and accessible to me in my area, and I don't have an alternative. So now I don't have food. But
So,
yet,
dumb question.
go ahead.
Are we working with the FDA on this?
So that kind of all falls under the same umbrella, right? HHS tends to have a far reach, and I wouldn't say that they're working with them, but I would say that they're pretty much, I'm sure, playing in the same sandbox, right? And if the person who's running one is not talking to the other, first problem, but if they are talking to each other and they are letting each other kind of run roughshod off of any and everything that comes up, it kind of gets into be a problem, right? And that's the issue that we're running into. The idea that they came up with is we're going to start doing certain stuff to make America better and healthier and all this. Got it. Most people love the proverbial chant of getting people healthier. I don't think anybody's going to stand up and say, no, 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 we want you to stay unhealthy, especially people on the
Right.
clinical side. But the first question I'm going to ask after you say we're going to make people healthy, what do you think my first question is going to be?
How you gonna do that?
How are you going to do that, right? And if you say, well, we don't
Hmm.
know, then why are we even talking? Other than it sounds good on the news, it sounds good in these sound bites and these clips. But if you really sit down and pull back of the 120 initiatives, what they're doing and how they're doing it, there's no strategy. It's just people
Mm-mm.
doing stuff and saying they're working. It's like, you know how they say you are doing busy work? Like I'm here and I'm doing stuff to look busy. I think that's what they're doing. And by them doing that, you get so confused that you don't really know what they're doing. And then by the time it's all said and done, you look back and like, well, none of that worked. And it's like, well, we're going to show the ones that did have a little bit of progress. The ones that were horrible, we're going to act like never happened. And yet we went on this crazy campaign of doing all this stuff, and we only got 10% results that are actually worth looking into. It makes absolutely no sense because at the end of the day, if you don't have a definition for ultra processed foods, as one example, how are you going to target them? Doesn't make sense, right? If you're talking about eliminating access to, I'm sorry, changing what's in the school lunches because you want to find healthier options. But then when we say, well, how do you measure what is or what isn't healthy, and you have no standard definition, then you're just changing stuff. You're changing stuff because you think it's unhealthy. And that's the problem we have. And you brought up vaccines. That's the anecdotal thing. People tend to say, I don't want to do A, B, or C. And if you ask them why, they have a bunch of answers. But then when you say, well, what's the alternative? They just pick random stuff that's not really based in science or health. It's based in anecdotes. It's based in theory. It's based in something they saw on social media, and there's no scientific evidence behind it, but they believe it so strongly that now they think everybody should do the exact same thing rather than saying, let's try it over and over again and prove that it works before we actually make this a mandate. And it makes no sense. So that's the part that when I heard about it, and a lot of people in healthcare that I'm familiar with, no one really and truthfully on the clinical side that I'm aware of is sitting there championing it, singing it from the rooftops that this is a great idea. They're kind of just saying it's just stuff that's being done, and no one's really like reading and saying, yeah, this is a great thing. Let's all get behind it. The people who are usually getting behind it are usually using it from a polarizing sense. And now that it's polarized, they like the idea, so they're running with it, but it's not scientific or evidence based. And that's the part that I just was like, you know what? Here we go again. We're doing more stuff, just like when we're doing the insurance based healthcare system. We're putting a lot of emphasis on all of these metrics and these standards and all this, and people are still really sick. So why are we doing a lot of that? Okay, so now you come in and say, well, that didn't work, so let's try something different. Okay, that's fine. How are we doing it? Well, we don't really have a plan. We just gonna start doing stuff. Okay, that might work, but more than likely it won't, right?
It
So
won't.
that's why I was a
Right.
little confused about it. So, tell me any thoughts you have, and I'm gonna ask you because I'm on the clinical side. You're possibly on the consumer side. Have you heard any initiative specifically under that umbrella of the Maha movement that you can say, this is the one that I heard, and it's really well done, really well thought out?
I've heard of them removing vaccines, but then again, then I heard of measles and chicken pox, things I haven't heard of in like 30 years.
Hmm.
But also, I've been hearing like food dyes, removing removing food dyes. So like your Skittles gonna be gray. I must really want a bag of Skittles because I mentioned Skittles a lot.
Yeah,
But
you
but
definitely on
but
your Skittles kick.
but like for example, that's what I've heard. Food dyes, right? So like your candies and some of your sodas and things like that, the color might not be what you're used to anymore.
Hmm.
But that's essentially don't that's all I've heard of.
Yeah.
Rolling back vaccines and getting rid of food dye, um, and that's it.
Yeah.
That's all I've heard of.
Yeah, and I think the other thing is that they're, trying to put these new agencies together to do more metrics and more measuring, but the problem is who's going to actually set the standard for the measurements? Who's going to collect the data? When are they going to collect the data? Where are they going to collect the data?
Correct.
Who's going to pay for the data collection? Like it's a bunch of, we don't have a target thing that we're focusing on, rolling that out, doing it very well, and then adding something else. We just picked 120 or so things that are potentially problematic, and we're just going to start attacking, addressing, changing, substituting, and doing all of that simultaneously. And there's no rhyme or reason as to this is a true need, this is not a true need, this is a high need, this is a low need. It's just doing stuff. And that's why I said the amount of stuff
Sounds
that's in here sounds good on paper. But if you ask anyone, what are you all doing and how you're doing it, no one is saying this is exactly what we're doing. I'm
sounds
looking
par
at
for the
some of the
course to
stuff
me.
now. Yeah. Oh, well, I'm looking at a few things now. So, few things: improve food quality in schools, right? So menus should have things like full fat milk options, less processed food. Again, sounds fine on paper. Use of
Wait,
SNAP waivers to
wait, wait,
promote
wait, wait, wait,
healthier
wait, wait.
food
We gonna
choices.
give people full fat food option, milk options,
Full fat milk, full fat milk, or whole milk.
whole milk.
So, because
So, yeah,
again,
that's a good idea. Let's get rid of the 2% milk. Let's get kids whole milk.
I mean, I'm not going to say that there's a bad side to that, but what I will say is it's stuff that you need to understand. If you don't have logic and science behind it, it sounds good. And then all of a sudden people start getting sick. And the people who listen to you, because you're
About to
supposedly in a
say.
position of power or authority, they're going to look at you and say, well, why did you do that? And all you can say is, well, we thought it sounded good on paper, right? Having more attention to pediatric mental health is great in theory. But if you say, well, how are we going to do it? Well, we're just going to take all their phones away and cut down on their screen time. In a way, I think that sounds good, but you saw what happened across the across the ocean when you took away a lot of young people's screen time. They started burning down the Capitol and stuff like that. Now, that's a far cry from what would happen here, but don't think that taking away screen time and decreasing social media is just going to magically make everything better when people tend to rely and depend upon that. And some people, that is their lifeline. If they don't have anybody they can call and depend on locally, their family is not in the best state, they may need social media to have connection and to do things that are helpful and beneficial to them from a mental health standpoint. But you're taking that away because you think, oh, this is the worst thing, so let's just do
I,
less of that. Like it makes no
I don't
sense.
know, bro. Watching people fall downstairs and watching like these dogs get eaten by alligators is very good for my mental health. I don't know about anybody else, but you know, I'm
Well,
just, I'm sitting there watching some of this foolishness, and that actually kind of makes a bad day kind of solid sometimes.
makes you feel a little bit better, which I appreciate. And I'm not upset with the idea that some videos of foolishness on social media are helpful and also probably add levity to things that will, in a stressful moment make you feel better. But that's why I said, like, it's the ideas and the poor execution that really has me just, scratching my head. And and the fact that we can't, in this episode, talk about tangible things that they're doing other than very, very conceptual, high level, idealistic things. Like that's all you can say. Like there isn't one specific initiative you can put your hands on that you could say, yeah, I believe this is going to be done. It's going to be done really well. It sounds good on paper, but it's not really a method to the madness. It's just madness, right? So I really do want school-based nutrition to be better. I would like children to have better food options. But if you're taking away the food that they have, and now there's no free lunch because that program is being gutted, and now the children are now having to basically figure out what food options are there that you
Bruh,
took away, which was the only meal they're going to have. How do you think they're going to get healthier? Like that's not going to help their
that's
mental health
ridiculous.
either. It's just backwards. So I just say that I think that they're doing the exact opposite of what they're supposedly trying to do. the Make America Healthy Again idea is actually almost, to me, a cover up for we're going to do harm. And the first thing that we are supposedly doing in medical school, when we take that first oath, the first thing of the oath is first do no harm, right? You don't want people to get more, uh, you don't want them to have more illness or become sicker because you're overdoing it. And you don't want them to get sicker or have more illness because you're underdoing it. So we really and truthfully say, look, how do we get the right answer? Well, it comes down to data, it comes down to science, it comes down to practicing evidence-based medicine. If you're doing that, everything else should be fine. If you're doing kind of what the current, uh, let's say, administration is doing when it comes to the Health and Human Services Department, it's just doing a bunch of stuff and putting people in certain seats that will potentially not have a health background, not have any incentive to do right by people other than people who are lining their pockets is not a good
Hmm.
place when it comes to medicine. Medicine shouldn't have all the what is the word I'm looking for? Politics in it.
Political.
It shouldn't be
Yeah.
as politicized. It should be a lot better in the idea of we're going to do right by people because the best thing we can do is keep people healthy. But people are going to learn the hard way. And that's the only thing that I fear more than, just people being flat out lied to is that they're being lied to, they're being misled, and they're going to find out and pay for it with their lives. And that's not something any doctor wants to say, but I'm pretty sure a lot of doctors know and believe that to be true. So, with that, we're going to slowly close out. Um, if you have listened this far, you're a real one. We really believe that you're doing great work, and we really believe that you are doing the work of a lot of people by listening to us and kind of going through the whole episode. But liking, subscribing, sharing, following, all that stuff means a lot to us. And more importantly, it allows us to say we're hopefully making a difference in our community and also the people that are getting healthier by engaging with us, engaging with their medical professionals, taking the stuff we're saying, looking into it, researching it, and doing it in a way that allows them to get better. So we appreciate that. I really will say that. I will also possibly apologize that we're on this soapbox about how this stuff is just pure foolishness. But I did feel like we couldn't come into season 4 without highlighting how much crazy foolishness in the medical field has happened since we did our last episode in July or so. So from July, if not July, it was June, late June, early July. In 3 months, 3 solid months, it's been chaos. So quarter 3 was chaos, right? We're ending quarter 3 as we record this in September, heading into quarter 4. But it just goes to show you that healthcare changes rapidly. Medicine changes rapidly, pharmacology rapidly. And in that space, things get better. It may not seem like it's better, but it's probably a lot better than what it was 30, 40, 50, 60, 70 years ago. So if you look at things from an evidence-based standpoint, you'll see the benefit. And hopefully you'll say, okay, let me really and truthfully research it, not just drink from the proverbial fire hose of foolishness and hope everything's going to be okay. With that being said, patient zero. Before we close out, do you have anything you want to share with the people about today's episode or just things in general?
My PSAs all sound the same at this point. You know, do your own research. You know, if what we've said today sparked a thought, you know, look it up. Do some research on these HSAs. Look at what you're spending on prescriptions and over the counter care and things of that nature. Um, Take a look at your doctor visits. Take a look at how much you spent there. Take a look at your premiums, open enrollment, and that's why I'm shout out to Dr. Jasper for the timing of this episode because open enrollment is typically in October. You look at these things and do your due diligence and again make the decisions for yourself that fit your finances. If you're making, I don't know, $700,000 a year and you don't mind spending astronomical amounts on insurance premium, more power to you. But most Americans not in that type of position. So um re- crunch the numbers. If you don't know or if you have questions, do the research, ask the right people. We're always here for you. And, and make a sound conscious decision for yourself and do what's best for you and your family.
Absolutely. So I appreciate that. And yes, it's starting to sound the same. No, I'm just messing with you. So at this point, I think I'll just add that for the beginning of the episode, as we mentioned, when it comes to HSAs, you have to more than likely be an advocate if your HR department is not really talking about it, let alone be an advocate for direct primary care if you are a believer in the movement and believer in how it can help not only you, but your family and things of that nature. What tends to happen with a lot of people is they assume that if it's good for them, then somebody else is just going to magically find it in healthcare. And a lot of times you have to be an advocate for people who can't advocate for themselves. So if you have coworkers, it's one thing to just tell them you should consider direct primary care, but it's another thing to go to the human resources department and advocate for it so people can start to get the benefit from direct primary care on a grander scale. So if you're not doing that and you really believe in it, then do that. I know a lot of our patients tend to go to their employers and bring it to them. The problem is most people in HR have no idea what they're talking about. But now that there's legislation on the books, you may have a little more momentum into that conversation rather than you just kind of talking to people and hoping they know what you're talking about. So if you're not doing that, please go ahead and get that done. Second thing I'll mention, you already heard me say it like 20 times. If you're going to listen to people who are sitting in positions of power about your health, please, please, please make sure they know what they're talking about. And more importantly, make sure you vet what they're saying. Don't just take it at face value. And that could be even with me, Dr. Jasper. Anything that I'm saying is usually evidence-based. And if it's evidence-based, that means I've looked it up. I've been researching it. It's been researched over and over, and it's been proven to work. So you can vet what I'm saying over and over again. It's not just something that happened to somebody one place in a different state that you never heard. It's anecdotal about this story, and it never gets actually proven, but it sounds really, really convincing. Our stuff is convincing because it's data driven, it's evidence based. So please do that if you haven't done that already. Please make sure you're doing that so you're not going down the rabbit hole of foolishness and having bad things happen to you and your family. Finally, we will close out with where the people can find us. For that, Patient Zero, where can the people find you outside of the Byja Radio Show?
They can find me on X. I still like to call it Twitter. That's just me. George underscore Becnel at Becnel Media on LinkedIn. I'm not on LinkedIn, excuse me. At Becnel Media on Instagram and George P. Becnel the second on LinkedIn.
All right. And for us, as you already know, you can find us on Byja Radio because you're listening to us, obviously. We are on different platforms right now. We are on, I believe, Spotify, Apple Podcasts, YouTube, iHeartRadio, maybe on some others, but those are the four that I remember offhand. Patient Zero is our production guy, so he's going to, of course, add more in if we need to. For our clinic, you
Yep.
can find us online at www.byja.org. For our nonprofit that we are using to give people access to direct primary care who may not be able to afford access, if you'd like to make a donation to that platform, you can find us online at www.byjaca.org. You also can eventually find us on our website for Byja Broadcasting Enterprise, or BBE, which is coming. Stay on the lookout for our upcoming network partner, new show coming out, Premium Perspective, which we already talked about. Also, you can find myself on, find our clinic on Facebook and on Instagram and on LinkedIn. And finally, definitely look up the Byja Blueprint book, a book talking about introducing direct primary care to patients, businesses, and physicians alike, and why the model is so awesome. With that, we're going to go ahead and close out the first episode of season 4, episode 35. Again, like, subscribe, share, do all the things that are great that allows us to keep spreading the word and growing Byja Radio and the Byja network. And we really appreciate you and thank you for listening in.